So let's clue into the viewers. What's going on over there?
A lot of hip pain. I had a hip replacement, and after the hip replacement, I didn't want to fall on this hip because the doctor told me once I fall, this hip's going to pop out. So I slipped in front of my home. So I grabbed the fence in order to not fall on the hip. So I ended up twisting my knee. Right after that, there was a lot more pain here in this hip.
All right.
So this pain came on, and then the knee pain just kept going with therapy and everything else. It just never went away.
Understood. All right. Alright, so we see something here at this level. I see another one right here. Okay, let's tilt your head a little bit like that. Thank you. And you have another one right there. How's this fellow over here? Not too bad, huh?
No, not too bad.
But this fella,
Yeah.
that's not fun. See, I feel all the swelling right in there. Yeah, not too bad. It's just right here, the medial component of it. Yeah, also right here as well.
Yeah.
Pain right there too, huh? Yeah. So that gaped wide open there too. Sorry, don't mean to poke that fella. So which one's worse, on the left hip or your sacrum there? Yeah, right there, that ain't moving. That's a brick wall. This ilium is not too thrilled either, but it's not as bad as sacrum. That sacrum is really jammed up. See, you're right, sacroiliac joint, that's moving just fine. But I'm also starting to see, yeah, there it is. So your 5 is moving just fine. And we'll move to the 4. You feel that fella right there?
Yeah.
That fella's not too fun either, huh? See, that's not moving. It's supposed to move. That's what normal's supposed to be. And it shouldn't be just swollen over here, and yet it is. And you hold that body over here. See over here, this is nice and smooth.
Yeah.
And over here, see, this is hard. It's very rigid. All your muscles, your postural muscles over here, very stiff. Here we got something here. Feel all that fella right there?
On that side, yeah.
Yeah, that's not fun. See, we have like pretty much no movement in here. See, I could barely tilt your head to the left. The right, just like almost nothing in there. So we're gonna take a closer look, see what's going on with this poor fellow over here. Right. So for the viewers, that's what a hip replacement looks like on the x-ray itself. And it looked like in the past, and it's still continuing on, you've got a lot of degeneration, a breakdown over here.
Okay.
It's similar to what we're expecting for the lumbar spine, normal, and yet I see a lot of this in your hip.
Okay.
So that's why I'm not surprised they had to do a hip replacement surgery on that fella. But when I take a look on your left side, I also see a lot of breakdown, like between these two over here, like over here.
Okay.
Right? The good news is I don't see the bones touching. Right? What I do see as a yellow flag is that it's not smooth.
Okay.
It's right. As in other words, like a ball and socket joint over here.
Right.
I'll show you another example. Now, I don't have a femoral acetabulate joint, but you get the gist of it. With this shoulder model over here, like this joint over here, it should be a nice smooth socket like this.
Yeah, like a ball and smooth.
Right, it should be like a ball and socket.
Okay.
That's what I'm expecting over here.
Yeah.
I see some damage on the outside, so like over here, if we were to pretend this is a femur, the leg,
Yeah.
right, then I'm seeing damages over here. So in other words, when we extend it, and I would not be surprised, actually face towards the viewers over there, and then Try to do this over here. Can you do this sideways?
That's about it right there.
Doesn't feel that fun, right?
No.
And what about going this way? Can you do that way?
That's about it.
Right, it doesn't feel that fun, right? So that's what we're seeing over here, right? Because you got some arthritic damages on the outside over there, that's what makes it difficult for you to abduct and also flexion of the hip over there.
Gotcha.
So it feels all that, yeah, it's not so fun over there.
Okay.
Now, next component, and that's what we're confirming the X-ray so far. Is this sacrum over here? That's in trouble. We need to correct that first. And I made the jury rig in the future visit. We're going to keep an eye on actually both iliums. Even though this one seems to be fine, I may need to tweak that from time to time just to make sure this fella stays put.
Oh, really?
Because I want to try to save that.
Okay.
Right? Because if we continue what you're doing, right, eventually this is going to need a hip replacement as well.
Trying to avoid that.
Right? Well,
Okay.
like I said, no guarantee, but I'm going to do what I can. Because when the body's in proper alignment,
Yeah.
then the body can start rebuilding and regenerate that joint over there.
Okay.
But of course, there's a certain limit, right?
Right.
And we're gonna play it by ear, see how that thing regenerates.
Okay.
Next component is this fourth lumbar over there, right? That one, what that's involved is like this. Why is the fourth lumbar important? And we're gonna touch base again very shortly with your knee X-ray as well.
Okay.
So, the fourth lumbar, it supplies nerve innervation to the sacroiliac joint. So it's kind of crucial.
Gotcha.
And then we're going to tie in on what I was talking about before. You also complain about, okay, this fella is not fun at all.
No.
So we got a couple combinations, all right? Is that this nerve over here supplies nerve function to the knee. I'm also seeing on the X-ray, this thing is compromised. So because it got compromised, the nerve got pinched off. That's why the pelvis itself having some problems keeping itself in a proper alignment, and even your knees having some trouble keeping themselves in proper alignment as well. So that's why, after we correct this pelvic foundation, I'm going to double check that fourth lumbar. Very good chance you probably need a correction for that one too. Get those nerves firing again.
Okay.
Now, touching base what we discussed before. Now, if your fourth lumbar nerve was functioning properly, this is your kneecap over here. The patellas should be in the middle.
Okay.
This tip over here should be here. This one, you see, is way out.
Wow.
Should be over here. Right. That's what normal is supposed to be. But as you can see, since they're both going out this way,
Yeah.
that tells me no. This muscle over here is what we call the VMO.
Yeah.
Okay. The one right over here, the vastus medialis oblique, is not getting enough nerve function.
Gotcha.
So that's what's holding the patella, the kneecaps, in proper alignment. But because muscles are weak, everything else is still working fine. So therefore, it's going to pull it towards the outside.
Oh, I see.
So your IT band, like everything else, the whole time 9 yards, the quads, everything else is going to start deviating on the outside.
Wow.
Right? So that's what we got dealing with. So that's why I suggested before, very good chance we still may have to correct that fourth lumbar after all.
Okay.
Now in terms of your knee itself, where you said it's not fun, well, here's the story with this one. See this over here? That's a proper alignment. It should line up just like that. See how much is sticking out?
Yeah.
Yeah. So what we got over here is that the whole entire knee, see from here, it moved that way.
Oh, I see.
Right? So this is what we would call tibia with an EX side slip. So I got to push this bone over here inside that way. And on top of the way this thing moved, it moved like way this way. So yeah, so that's what we're going to address. Okay, so keep in mind because he had that hip replacement surgery over here, right? That's why we can't really address and correct this one on the pelvic bench table. So we have to correct this fella prone. So we'll further aggravate that hip joint over there, and plus that knee he got going on. So we're gonna fix the sacrum right over here. Just gotta relax, let it all drop right. There we go. There's the magic in that one. So now we're gonna test it. See this one over here? That's your fifth lumbar. I can move that. Feel that right there? That's a brick wall. That's that fourth lumbar. It's not a happy camper. Okay, I'm gonna pump this up first. Just let it all go. A little more. Oh yeah. That's a little stuck. Let's get a little more love out of that fella. Yeah. Got a little more out of it. Okay, it's time to give. Okay, just relax right there. There we go. Tender right there?
Yeah.
Yeah. So what we're gonna do first is we're gonna pump this fluid right in there. There you go. There it is. Woo. That was a beauty.
Mm-hmm. Got a little bit of the edge off.
Which edge? Just
Or sharpness in the knee.
sharpness in the knee. Okay, that's good. How's everything else?
The hip, some of the edges off also. It's not as sharp, the pain, when I walk. Wow. Woo. Jeez. Yeah. That grinding that I used to feel is not there. I can still feel there's a little soreness, but it's not there. It's good. Much better.
All right.
Good?
Okay, so let's give a couple other things I want you to test. With that left one, can you do this?
Try. That's about it right there.
Okay, let's try with the right one. Okay. And then try to go this way. And then versus the right one. Okay. Give us the latest updates. How are things?
Things are a little bit better. It's not as sharp, the pain. And so, I go back and forth up and down the steps in my home. So after a while, the pain does come back in the knee for sure. The hip, not as bad, but the knees, they really give me some trouble.
All right. That's some good progress. A little bit there. Yeah. See, this is still stuck right there. Oh, this is moving better. Yeah, see, it's still fixated, stuck in rotation. See, it's also inferiority is stuck there too. So the fourth lumbar, we still need to work to do. That's all. Let's unlock your pelvis first. And then, let it open. Then, sweet. Right there. Let it all go. Good. Let's work on this knee over here. Feel that, right?
Yeah.
Yeah, that's still tender right there, right? Yeah, see, we still got the swelling right here.
Yeah.
Oh, there's a piece. I'm gonna keep bumping this up until we get that little cyst back in place. There we go. Just get a little more of it. Bump it up a little more. There we go.
Woo. Wow. Yeah. Felt that one in my hair follicles that I don't have. Wow. Woo. Whoa.
All right. Go ahead. Well, hey,
Yeah,
lift
look
it
at
up.
that.
See how far it
Comes up a little more and it can bend a little bit.
Good.
Oh, Jesus. Wow.
Hey, well, that's a work in progress, brother.
Yeah. Wow. Feels good though. That feels good. Feels a little good over here too. I'm not getting that sharpness.
Good.
like it's dull. Very good. Very good. Very good. Oh, the pain's not as sharp, and I can actually move this.
How far can you lift up now?
Come up with it. I can actually come all the way up like I used to. Wow.
All the way up, huh? Try to go this way, sideways.
Come on.
How's that now?
Yeah. It's just a little stiff in here, but I can come out. I can come out.
All right, that's great progress. All right, we'll see you next visit.
All right.